everyone. We are GroupB Team1, and this is our topic. Can we treat Alzheimer's 20 years earlier? These are the famous people who suffered from the Alzheimer's disease, and the left one is Mrs. Thatcher, and the right one is the Vice President Reagan. And this is the outline of our presentation. And now I'm going to discuss about the etiology of the Alzheimer's. The Alzheimer's disease is discovered by a German psychiatrist and pathologist who is known as the unlost Alzheimer. It is also one of the most financially costly diseases in the developed countries. It is a type of chronic neurodegenerative disease, and the risk of getting this disease is genetic, head injuries, depression, and also hypertension. Now we are going to talk about the changes that happen in the brain. In the Alzheimer's disease patient, the cerebral cortex and the hippocampus of the brain are decreased in size. Besides that, the ventricles are also enlarged in the brain, and this may affect the language and also the memory of the patient. In the PET brain scan, we can see that there are a lot of blue and black regions in the brain, and this indicates the reduced brain activity in the brain. And these are the causes of the disease. The first one is the amyloid hypothesis, and the second is the tau hypothesis. In the amyloid hypothesis, there are formation of neurofibrillary tangles and also amyloid plaques in the brain cells. The accumulation of the plaques and the tangles would affect the transmission of the neuron in the transmission of synaptic neurons in the brain cells. And in the tau hypothesis, there are changes in the tau protein. The changes in the tau protein can lead to the disintegration of the microtubules in the brain. And the disintegration of the microtubules would eventually affect the brain activities of the Alzheimer's disease patient.
Next, I would like to talk about the different stages of disease and the way it progresses. So the first stage is the preclinical stage. At this stage, the patients appear to be completely normal. For this part here, I would like to use an iceberg as an analogy, because by the time that the symptoms of Alzheimer's disease have percolated up to the surface, that process has already been going on in the brain for 10 or maybe even 20 years. The second stage is the mild Alzheimer's disease, which is often referred as mild cognitive impairment. The symptoms are memory loss, confusion, poor judgment, mood changes, and increased anxiety. And the third stage is the moderate Alzheimer's disease. The patients will have problems recognizing people, difficulty with language and thought, repetitive statements and movements, and loss of impulse control, such as undressing at appropriate time and places. So the last stage is the severe Alzheimer's disease. At this point, the patients cannot recognize their family members completely and even communicate with them. Their muscle mass and mobility will deteriorate to the point that the patient has to be bedridden. So that is why the patients often completely dependent on others for care. So this graph shows the trajectory of normal aging and patients with dementia. As we can see here, the cognitive functions of patients decreases in each stage and also with the increase of time. Each stage shown here correspond to the symptoms that I have mentioned previously, and the symptoms tend to be cumulative and worsen over the time.
To talk about treatment options, and there's no cure for Alzheimer's disease, and current treatment has little benefits to our systems, and we divide our current treatment into two parts. The first part is pharmaceutical, and the second part is psychosocial. And for the drug we use, we have 5 drugs, and we divide into 2 groups. The first is acetylcholinesterase inhibitors, and the second one is NMDA receptor antagonist. And both of them have side effects will induce vomiting and nausea. And for psychosocial intervention, we have the behavioral intervention and emotional oriented interventions. And I would like to show one of the new technology in the TED Talk. It used the monoclonal antibody vaccine, and we can see that in the right picture, there are reduction of amyloid burden, but unfortunately, it didn't work on the person who have Alzheimer's and had already lost 70% of its neurons. So the presenter showed us a secondary prevention as well. We need to prevent and slow the emergence of the clinical syndrome, and who are genetic at risk and age at risk, and amyloid positive biomarker. And we hope someday we can find primary prevention on age 12.
Now we want to introduce how to prevent Alzheimer's disease. First, we can use diet restrictions. Mediterranean diet beneficial cardiovascular effect has been proposed as a mechanism of action. And the second, we want to introduce activities of daily life. Some life experience result in more efficient in neural functioning, providing the individual a cognitive reserve that delays the onset of dementia manifestation. Third, exercise. There is no other therapy comparable to exercise on delayed aging and Alzheimer's disease. At present, there is no definitive evidence to support that any particular measure is effective in preventing Alzheimer's disease. Only further research, including clinical trials, will reveal whether these factors can help to prevent Alzheimer's disease. This is our presentation. Thank you for your listening.